Welcome back to Community Health Heroes. Did you know Daughters of Charity Health Centers provide care for chronic illnesses such as asthma, cardiovascular disease, diabetes, and depression? Also available at select health centers are services for women's health, behavioral and mental health, dental, optometry, pharmacy, podiatry, and WIC, which stands for Women, Infants, and Children. In addition to all these programs, Daughters of Charity Health Centers are reaching out to clients to help them with social services through the Care Fellowship Program that's funded by United Healthcare. Here to tell us more about a recent $1 million grant is Zwena Randolph, Director of Business Development and Community Engagement for Daughters of Charity Health Centers. Thank you for joining us, Zwena.
Thank you for having me.
Great to see you. I wanted to ask you, first of all, what is the Care Fellowship Program?
Okay, so the Care Fellowship Program is this awesome program that is offered at Daughters of Charity Health Centers in New Orleans, and it is a group of community health workers that work together to address social determinants of health. And social determinants of health are things that prevent people from being able to make health a priority in their lives. So if they have any deficiencies with housing, transportation, job security, food security, we work hard to address those needs for them so that we can get them back on track with their health.
And I know that United Healthcare has played a big part of the Care Fellowship Program. Tell me what they did in 2018 and what they just did this year.
So in 2018, United Healthcare gave us $1.5 million to hire 15 community health workers to help address those social determinants of health. And then in 2019, they gave us another $1 million to continue fulfilling that dream and that journey of going out into the community and just really impacting people's lives, not just in the health centers, but outside, meeting them where they are and help address those needs that are very important in order for you to get your health on track.
And I take it in 2019, you're going to continue some of the programs, which include you help people find housing, applying for SNAP food stamp benefits, seeking abuse treatment, and do primary care and outreach. Those are some of the type of things you're going to pursue again this year as well?
Yes, so this year we're going to continue to do that, but we're also moving into special populations. So we're looking at maybe having some community health workers work completely with our prenatal population, with our infectious disease population, and also with our behavioral health patients.
What type of clients are they? Where do they live? Why do they need this type of help?
They're all over the city, and not just New Orleans, but in Metairie, in Kenner, on the West Bank, in Jefferson Parish. They need help with, of course, your typical housing, transportation, but we also have people that are just lonely and need other activities to be involved in for socialization. We have people that are looking for weight loss programs and groups to join. So it's just a variety of different things that we're helping people with and that we're seeing as an issue that I don't think that we really realize were issues in the community.
Gotcha. I know that these grants are part of United Healthcare's Empowering Health Commitment, and I know Daughters of Charity is kind of taking on that mission when it comes to social determinants. You mentioned earlier that you try to reach people in high risk and high need areas. Why is this trend now becoming so prevalent, where instead of just providing the primary care, you're actually going into communities helping? That really does affect people's overall health, right?
Health doesn't start when you reach the doctor's office. So there's so many obstacles that plague people just getting out of the front door, that just making it to the doctor's office is a huge feat. And so if we're able to help put a plan in place and assist them in getting those social needs, those more personal needs addressed, then they can tackle their health better.
I know there's 3 really big things that you guys are tackling right now. According to United Health Foundation's America's Health Rankings last year, Louisiana ranked 50 among all U.S. states in overall health factors, including smoking, obesity, and children in poverty. So in terms of Daughters Charity, making a commitment to help, especially with these 3 issues, do you feel like this new Care Fellowship program is kind of helping with the 3, smoking, obesity, and children in poverty?
Yes. So one of the big things is getting people signed up for smoking cessation. So It's everything. It's everything that a person needs to just have a genuine and free and beautiful life. Everything that we're doing is trying to help those things happen for them, which are barriers for them just to get proper health. And it's just so nice to just be a part of the Care Fellowship.
So how can our viewers learn more about Daughters of Charity, see if they can get involved in all this?
Oh, you can go on Daughters of Charity's website, which is dchcno.org.
Great. Well, Zwena, thank you so much for being here today, and thank you for sharing all this great news, and hopefully we'll hear more about your great program.
Thank you.
Thank you. When we return, we'll take you to the Daughters of Charity Health Center's headquarters and talk with its president and CEO to learn more about what services may be available for you. We'll be right back.